Hi everyone, so welcome back to Monday Reading Live. This is me Vandana PS joining you from Nidhu's Academy. Okay, so in the last class we were discussing about part A only. So today in this class I'll give you a sample question from part B. Then as usual, let's discuss the answers for part A. Okay, so for that I'll give you 2 minutes for the completion of this sample question. So here comes the question. Okay, so have you all done the question? Okay, so I'm just looking into the comments. Okay, yes, Nelsie, Sobi, Yogeshwari, Vidya. Yes, good afternoon, everyone. Okay, so how is the question? A very simple question, right? Okay, so this is a sample question for the last category, which is a memo here. Okay, so I'll read the question, then let's discuss the answer, okay? So the report mentioned in the memo suggests that. Okay, so what is the first step? And you guys know about how to do a sample question from part B. Okay, so yes, the report mentioned in the memo suggests. Yes, so what are the keywords here? Okay, so only through underlining certain keywords you will get to know about the question, okay? So my keywords, the report, then memo, suggests. Okay, yes, Dar Mohsin, hi. Okay, Renu, good afternoon. Yes, Ashna, good afternoon. Okay, so when you read a question, always connect with your options, okay? So it will be easy for you to identify the question. The report mentioned in the memo suggests that. Okay, so this is an incomplete question, so you can connect with your options. So option A. Data about patient errors may be incomplete. So my keywords, data, errors, incomplete. And from option B, the memo suggests that errors by hospital staff can often go unreported. Okay, so my keywords, errors, then often, unreported. And from option C, errors in prescriptions pose the greatest threat to patients. So my keywords, errors, then pose which means create, develop, okay? Then greatest threat, so I am just marking threat. Okay, so these are the keywords from the question. Clear? Okay, hi Jisha, yes Beena, good afternoon. Okay, so any idea guys, what is the correct answer for this question? Can you please comment it here? Let me know the correct answer. What is your answer for this particular question? Okay, I'll read the paragraph, then I'll check your answers, okay? So memo, report on oral anti-cancer medications. So this is all about a memo, so which means the third category. Okay, so what are you reading for in this category? If it is an email or a memo, then if it is a notice, then we are reading for the purpose. Okay, purpose which means the overall idea. So what is the purpose? Nurse unit managers are directed to review their systems for the administration of oral anti-cancer drugs and the reporting of drugs errors. Then serious concerns have been raised in the recent report drawing or a national survey of pharmacists. Okay, so please note the following paragraph quoted for the report. Incorrect doses of oral anti-cancer medicines have fatal consequences. Okay, it has a lot of fatal, dangerous consequences. Then over the previous 4 years, there were 3 deaths and 400 patient safety issues involving oral anti-cancer medicines. Half of the reports concerned, see, what about those reports? Half of the reports concerned the wrong dosage of frequency, quantity or duration of oral anti-cancer treatment. And further, in addition to that, concern is that errors on the part of patients may be underreported. Okay, then in light of these reports, a question is clearly asking you regarding report mentioned in the memo. So what about the report? Okay, half of the reports concern the wrong dosage of frequency, quantity or duration of oral anti-cancer treatment. Further, concern is that errors on the part of patients may be underreported. Okay, then in the light of these reports, there is clearly a need for improved systems covering the management of patients receiving oral therapies. Okay, so that's all about the para, a very small para. Okay, so I'm just looking into your answers. Okay. Okay, yes, Aishwarya, good afternoon dear. Okay, Dar Mohsen, your answer is option A. Then Sobi, option C, Shiny. Okay, Ashna, Vidya, Yogeshwari. Okay, Shiny, Sony, Jobin, Feba. Okay, and Dar is saying like, okay, A is the answer because unreported synonyms of incomplete suggestions means maybe. So A is the answer, right? Okay, so I'm coming back to the options, okay? Data about patient errors may be incomplete. Okay, So, and you guys know, see, they will not ever give you that direct sentence from the question or from the paragraph into the answer options. It will be definitely paraphrasing, and you know that. So what is paraphrasing? Okay, so paraphrasing, which means the same meaning will be there but entirely different sentence structure. So think like that. Okay, so where is that option C? Errors in prescriptions pose a greatest threat to patients. Errors in prescriptions. Okay, so where is it mentioned? That is a report. Errors in prescriptions pose a greatest threat to the patients. Where is it mentioned? Because a lot of option C answer. Okay, so where is it mentioned, guys? Errors in prescription creates a greatest threat to the patient. Okay, a greatest threat, I agree, it is mentioned there. Errors, okay. So what about the errors? What type of errors? Okay, hi Prija. Yes, how are you, dear? Okay. So I am coming back to the options. Option A, data about patient errors may be incomplete. Okay, where they have mentioned about it is incomplete. Data, which means the information. Okay, the report about patient errors may be incomplete. Okay, so that is clearly mentioned here. Half of the reports concern the wrong dosage frequency, quantity or duration of oral anti-cancer treatment. Then, of further concern is that errors on the part of the patient may be underreported. So what do you mean by underreported? Underreported, which means it is incomplete. Okay, the complete Allah, it's not complete. Okay, so from that line I can trace towards option A. Maybe, because we have two other options here. And what about option B? Errors by hospital staff can often go unreported. Often, which means always. Epporum unreported. Unreported, which means it is not reporting. Okay, so we can eliminate option B because it is not mentioned anywhere in the paragraph that these errors are always not reporting. ഒരിക്കലും report ചെയ്യുന്നില്ല. It's not even reporting. Okay, so where is it mentioned? Not mentioned. And what about option C? Errors in prescriptions pose create the greatest threat to patients. No, a lot of threats to patients. Okay, fatal consequences, not a single problem, a lot of problems. Okay, so I can eliminate option C because it is contradictory option, or I can say opposite option. C, incorrect doses of oral anti-cancer medicines have fatal consequences, not a threat, a lot of threats. Clear? So, answer is option A, whether you like it or not. Answer is option A, data about patient errors may be incomplete. Okay, so that is from the last lines. Okay, so when you read the third category, always give a special focus to the last lines. I'm not saying that, okay, last lines will be the answers, but still the last lines will give you a clue towards your answer. Okay, so that's all about this question. Any doubts? Okay, Prija. Yes. Is it clear, Sobi, Feba, Jobin, Sony, Shiny, Yogeshwari, Vidya? Okay, Renu, very good. Your answer is correct, okay? That's option A. Okay, so incomplete, which means underreported, and unreported, which means not reported. Okay, understand the difference between these two words. So that's that. Okay, so I'm moving to part A. So we have a new material today. It's all about contusion. Okay. Yes. So what about part A? Okay, I'll read all the text now, then I'll underline the keywords so that you guys can check your keywords. Okay, then we will discuss and find out the answers. All right. Okay, so text A. A contusion or bruise occurs when you receive a direct blow or an impact on your body. So when I read this, and in this particular time you guys can type your answers. I mean, what are the keywords from text A, text B, text C and text D, because I just want to know, okay, whether it is correct or not. So please do comment your answers. What are the keywords from these four texts? Okay, so please do it. Okay, so coming back, text A. So there is no heading, no subheading. A contusion, I am just marking the name of the disease condition, or a bruise occurs when you receive a direct blow or an impact on your body. Okay, when this occurs, the small blood vessels tear, which causes blood to leak under your skin. There are several types of contusions that can affect any part of your body, including your skin, bones, lungs, heart, brain, and muscles. You might get a contusion for a variety of reasons: car accidents, falls, spots, injuries, assaults, fights, or domestic violence, among other causes. Okay, then depending on the type of contusion you have, you may experience the following symptoms. So what are the symptoms? Skin contusion, discoloration of the skin that may appear pink, red, blue, purple or green. Then muscle contusion will be there, swelling, stiffness, muscle weakness. Then bone contusion will be there, stiffness, ache, swelling or heart lump. Brain contusion, bleeding and swelling inside and around the brain, headaches, loss of consciousness, seizures, slurred speech and trouble walking. Then lung contusion, difficult breathing, coughing or chest tenderness that usually appears 6 to 48 hours after the injury. So these are my keywords from text A. So what about you guys? Yes, Yogeshwari, please comment your keywords from text A. So may I know? Yes, Vidya, Sobi, Shiny, Renu, Prija, Ashna, okay, Jobin, Sony, Shiny. Yes, so what are the Aishwarya? Yes, Beena, Jisha, what are the keywords from text A? Okay, Shiny, your keywords, bruise, blood vessels, tear, reasons, types, symptoms, contusions. Okay, you don't have to underline the word tear. Okay, tear is not an important word. Then bruise, blood vessels, reasons, types, symptoms, contusions. Okay, fine. Okay, very good. Okay, anyone else? What is your keyword or what are your keywords from the first text? Let me know. What are your keywords from text A? Okay, I hope you guys are typing, okay? So I'll read the next one so that you can type it here. I'll read. Okay, Aishwarya, it's all about the symptoms. Very good, dear. Then text A, contusion, bruise, bones, lungs. Very good. Okay, Vidya, text A, small blood vessel under your skin, variety of reasons, type of contusion, symptoms, skin contusion, muscle contusion, bone contusion, brain contusion, lung contusion, and 6 to 48 hours. Okay, dear. So one suggestion, okay? When you underline keywords, it should be single words, not a combination of words, okay? For example, if you are marking, I'll show you an example. Yeah, from the first para, a contusion or bruise occurs when you receive. So suppose I'm marking a contusion of or bruise occurs when you receive direct blow or impact. So if you guys are marking like this, it will be very difficult for you to identify which are the important words, okay? So it's not necessary that you can underline individual words, okay? Separate individual words. Okay, yeah. So yes, you guys can mark it separately. Okay, so contusion is a word, then bruise, likewise when separate words, okay? Not a combination of words. Okay, Donna, causes, reasons, types and symptoms, okay dear. Prija, types, symptoms, bruise, contusion, blood vessels, okay dear. Beena, symptoms, contusion, part of body, excellent. Okay, Roshna, contusion, direct blow, very good. Bone contusion, brain contusion, the types, yeah. Lung contusion, 48 hours, skin contusion, also 6, okay, the number 6. It isn't a word, 6, okay, but it's a number. Then Renu, bruise, the small blood vessels, types, variety, heart lump, 48 hours after, okay dear, once more it is 6, it is also important, okay, it's a very small word there, but it's important. Okay, so that's all about that. So now we are moving to text B. So what about text B? So what are your keywords from text B? Okay, so clinical assessment. So there is a title. It's all about clinical assessment. Then X-ray takes pictures of your internal organs, then and looks for signs of lung and bone contusions. Then magnetic resonance imaging or MRI creates detailed images of your organs to check for bone, spinal, lung or cardiac related contusions. Then computerized tomography, that is CT scans. Okay, another imaging test is often used to check for evaluate the severity of contusion, brain contusions and identify any blood clots or internal bleeding. Then Glasgow Coma Scale, an important tool for determining the severity of brain injury or contusion by assessing your ability to follow directions. Then myelogram, a special type of X-ray that checks for spinal cord injuries. Okay. And the last one, ECG or EKG, records the electrical signals from the heart and is often always the first test healthcare providers use if they suspect a blunt cardiac injury. Okay. So these are my keywords from text to be a lot of words. Okay. So what about you guys? Okay. The keywords from text to be, let me know. What are the keywords from text to be? Any keywords that you guys have marked? Okay, or the same like me. Okay, so again I hope you guys are typing. I'll wait. Yeah. Okay, Aishwarya from part A, it's text A, it's X-ray. Okay dear, yeah, text B, right? Headings, clinical assessment, MRI, myelogram, CT, ECG, EKG, GCS, cardiac injury, spinal, lung, cardiac related conditions. Very good, excellent. Okay, Shiny, assessment, X-ray, MRI, CT scan, blood clots, internal bleeding, myelogram, ECG, blunt. Very good. Okay, Vidya, clinical assessment, X-ray, MRI, CT scans, Glasgow scale, myelogram, ECG, EKG. Okay, so B, clinical assessment, yeah, the title, X-ray, internal, very good. Lung, bone, MRI, image, very good. Cardiac related, CT, evaluate, very good. Clots, bleeding, Glasgow coma assessing. Myelogram, special EKG, ECG, electrical, healthcare. Okay, Donna, X-ray, CT scan, MRU, CGS, GCS, myelogram, ECG, EKG, special type of X-ray. Okay. Yes, Beena, X-ray, MRI, CT, GCS, scale, myelogram, ECG. Okay, Roshna. X-ray, internal organs, MRI, organs, bone, CT, brain contusion, internal bleeding, myelogram, spinal cord injury, ECG, blunt. Very good. Okay, Prija, internal bleeding. Very good. X-ray, bone, spine, lung, evaluate. Very good. MRI, cardiac, ECG, clinical assessment. Okay, so that's all about text B. So now text C, yeah, there is a pictorial, and you know every text will be different from one another, and one of the text will be a pictorial of something. So here we have a chart, a flow chart. Okay. So what about text C? A lot of numbers, so which means it's all about a study maybe. Okay, so it's all about a study. So all injuries registered on COR, abbreviation, that is 3875, 3875. Then hamstring injuries, 748. Injuries other than hamstring, that is 3127. Then injuries other than TMH, a lot of abbreviations mentioned. Okay, I'm just marking it because it looks like almost the same everything. MRI, then with no MRI. Symptomatic hamstring injuries with MRI. And hamstring injuries, 52. Hamstring injuries included analysis, 76. Okay, then incomplete information, it is 5. Re-injury during rehabilitation is 5. Treated surgically, it is 11. Then SMT, then RAFE injuries, it's 3. Okay. Yeah, so that's all about that. So if they have mentioned a very small box or something, so please read it very carefully because they will definitely ask questions from that. Okay. Then text D, the last one. Okay, so B, numbers and studies. Yes. Okay, dear. Okay, Prija, GCS scale. Okay, Jisha, X-ray, MRI, CT, ECG, GCS, myelogram. That's from text B, right? Okay, so what about text D? So what are your keywords from text D? So please let me know in the comment box so that I can correct you if there is any mistake. Okay, there are any mistakes. Okay, so it's all about management. Okay, a heading is there. So what is the subtitle? Treatments for every kind of bruise include. So what are the treatment options for different types of injuries mentioned here? Skin and muscle contusions using the RIC, okay, RICE protocol. Resting, icing, compressing and elevating of the location of the bruise, or taking non-steroidal anti-inflammatory drugs or NSAIDs such as ibuprofen or pain relief. Then bone contusion, applying ice to the injury. Then elevating to reduce swelling, wearing a brace to limit movement or further injury, and eating foods rich in calcium, protein or vitamin D to promote bone health. And lung contusion, which means supportive care from your healthcare team, consistent monitoring of your lung health to prevent lung failure and other complications, and the chest pain management. Then brain contusion, resting, managing swelling, reducing pressure in your brain, preventing the risk of seizures, and in some cases getting surgery to remove the contusion. And then spinal cord contusion, currently there is no treatment available to repair a damaged or bruised spinal cord. So healthcare providers try to manage the injury and reduce swelling by using medications like corticosteroids or recommending physical therapy. So these are my keywords from text D. So what about you? Okay, so what are the keywords from text D? A lot of keywords. Okay, plenty of keywords. Okay, so what are the keywords? I'll wait. So please let me know in the comment box what are your keywords from text D. Then only I'll move to the questions. So please let me know what are your keywords from text D. Okay, any suggestions, any keywords from text D? Yes, what are the keywords from text D? Okay, yes, Bina, treatment, then RICE, okay, RICE, NSAIDs, movements, prevention of risk, seizure, then care, spinal cord, okay, FIBA, RICE protocol, ibuprofen, elevate, brace, monitoring, surgery, physical therapy, okay. Yes, any other keywords? Okay, any other keywords? So what are the keywords from text D? Let me know in the comment box what are your keywords from text B. Okay, so that's that. Okay, so I'm I'm just moving to the question answers. Okay, so the first one, yes, okay, so be management, rice, NSAID, brackets, eyes wearing, brace, foods, calcium, protein, vitamin D, supportive team, monitoring, rest, swelling, pressure, seizure, currently, surgery, repair, damage, yeah, medication, corticosteroids, physical therapy, all the subheading, very good. Okay, very good, excellent. Okay, so the first question. Okay, so from the category of 1 to 7 set of questions, we have how many cases of hamstring injuries are recorded in the study group? Okay, study group. So where they've mentioned about the study group, so my only keyword is study group. Okay, so how many cases of hamstring injuries? So if you want, you can mark hamstring injuries also. Okay, so what about the first question? Any idea? Which text? Okay, FIBA. Okay, so B, yes. Okay, DONA. Okay, so where they've mentioned about that one. Okay, so answer is C. Very good. It's from text C. Hamstring injuries. Okay, so hamstring injuries, which is only mentioned in text C, and it's all about, as I already mentioned, study group. Okay, so answer is C. Yes, Priya, Raju, Arun, hi dear, how are you? Okay. Yes, Disha, Shiny, Dona, it's from C, text C. So jumping to the second question, how do we ascertain cardiac allied contusion? So my keywords ascertain, then cardiac allied which means associated, related, connected. Okay, allied which means associated, connected, related. Okay, so what about that particular question? What is your answer for that? Second one, how do we ascertain cardiac allied contusions? So what is the correct answer? How do we ascertain? Ascertain which means find out, identify, detect cardiac associated contusions. Okay. Okay, Shiny. Very good. Your answer is correct. Okay. So it's from B. Text B. Okay. So text B. And what about that one? Cardiac injury. So records of electrical signals from the heart and is often the first test healthcare providers use if they suspect a blunt cardiac injury. And again, that's from text B. So answer is very direct answer. It's from text B. Okay. Ascertain cardiac allied contusions. And the third question, considerations that lead to the commencement of contusion. Okay. So my keywords, which are considerations, then commencement. Yeah, so these are the keywords. Okay, considerations, lead, and commencement. So considerations, which means the factors that lead to the onset of contusion. Okay, so what are the factors that lead to the onset of contusion, the commencement of contusion? Any idea? Third one. Okay, so my answer for the third question, which is it's mentioned in text A. Okay, instead of factors, then lead to onset of contusion. So from the second and third points, you may get a contusion for a variety of reasons. So a lot of reasons are there, and depending on the type of contusion you have, you may experience the following symptoms. So this is all, it's all about several types as well as what are the symptoms. Okay, yes, Shiny, Sobi, Feba, it's from text A. Very good. Yes, Donna, it's from text A. Then the fourth question, what does RICE stand for? Okay, so the word RICE already we have marked when we mark the important keywords, right? So it's very easy. That's from, okay, text D. So RICE, which means what? Resting, icing, compressing and elevation or elevating the location. So answer will be from text D. Okay, then fifth one, which sort of contusion? Yes, okay, 𝐬𝐬𝐀𝐗, yes, it's from text D. Very good, dear, your answer is correct. Okay, Shiny, yes, fourth one D. Okay, yeah, fifth one, which sort of contusion might requisite the surgical intervention to precise it? Okay, sort of contusion, which means, yeah, the kind, which type of, okay, then requisite, which means which is important, then a surgical intervention to precise it, which means to correct it. Okay, correctly, precisely, which means to correct it. Okay, so what about the answer here, fifth one, what type of contusion might requisite a surgical intervention to correct it? Okay, so fifth one, that's also from text D. Very good. Yes, Sobi, Prija, Shiny, answer is D. Okay, so maybe repetitions will be there because it is 1 to 7 set of questions which are matched the following. Okay. Yes, then sixth one, the predominant technique employed to evaluate. Okay, so once again, I'll show you the answer for the fifth question. I'm so sorry for that. Which sort of contusion might requisite a surgical intervention to precise it? Okay, surgical intervention which is mentioned in text D. Okay, see, brain contusion, resting, managing swelling, reduce pressure in your brain, preventing the risk of seizures, and in some cases getting surgery. Okay, so that means surgical intervention which is from text D. Okay, then what about sixth one? The predominant technique employed to evaluate the severity of a brain injury contusion. So predominant, then evaluate, severity. So these are my keywords, okay? Any idea, Prija? Yes, Shiny, Sobi, 𝐬𝐬𝐀𝐗, Donna, Jisha, Feba. Okay, Prija. Yes, dear. Okay, so any idea? Sixth one, the prominent technique employed to evaluate the severity of a brain injury or contusion. Okay, so what about that one? Okay, so which is mentioned here in this clinical assessment, okay? So Glasgow Coma Scale, an important tool for determining the severity of brain injury. See? Okay, so that's from B. Okay, yes, Jisha and Feba, guys, it's not from text A, so I'm so sorry, it's B, the severity of the injury, the predominant technique employed. Okay, what technique we are using to identify the condition, severity of the brain, so that is from text B. Okay, okay, Prija, it's from text B, very good. And the last one, what are the characteristics of lung contusion? So my keywords, characteristics, lung contusion. Okay. Yeah, it's not necessary that you don't have to mark contusion because it is already, it's the material, it's the name of the material. So lung, yeah, that's fine. Characteristics and lung. Okay. So characteristics of lung contusion, types of contusions, one among them is lung contusion. So my answer is from A. Very good. Okay, so B, yes, Donna, it's from A. Okay, so any doubts regarding 1 to 7 set of questions? I hope it is clear. Hi Mariama, yes, good afternoon dear. Yes, Prija, it is from text A. Okay, Jisha, yes, Beena. Very good. So now 8 to 14 set of questions, that is short answer questions, okay. Then the first one, the device usually recommended to wear to limit movement or further injury following bone contusion. So what are the keywords? The device. So what device? An idea? What device usually recommended to wear to limit the movement of further injury? Okay, wearing. So what we are wearing? Yes. Okay, so that's from text D. So what we are wearing here? Okay, applying ice to the injury, elevating to reduce swelling, wearing a brace to limit movement. So answer is here we are wearing a brace, B-R-A-C-E, brace. Yes, okay, so B, Shiny, Ashna, it's brace from text D. Yes, Priya. Okay, Jitto. Yes, Renu, yes, it's from text D. Answer is brace. Okay, then 9th one. How long might the chest tenderness last post surgery? Okay, so how long? Then chest tenderness. So these are my keywords from the 9th question. Any idea? How long? So which means maybe, yeah, of course, time. So what about the time? Timing is only mentioned in text A. Okay, so that's in the last point. Chest tenderness that usually appears 6 to 48 hours. So my answer is 6 to 48 hours. Okay. Yes. Okay, Renu. Yes. Shiny, it's from text A. Yes, Aishwarya. Not 6 hours, dear. 6 to 48 hours. Okay. Okay, Donna, 6 to 48 hours. Yes, Priya, Ashna. Okay. Yes. And yes, Obi, don't write hyphen. Okay. 6 to 48. You can write SIX 6 to 48 hours. Okay. Whatever mentioned there, please write so. Okay. Then 10th one. The recommended medication to manage swelling associated with spinal cord contusion. So my keywords: recommended medication and spinal cord. Okay, so these are my keywords from 10th one. So what about that one? What is the correct answer for that? Okay, Yogeshwari, 6 to 48 hours. Very good, dear. Yes, Jisha, 6 to 48 hours. Yes, Feba, correct answer. Okay, 10th one. 10th question. Okay, so they need a medication. So medications mentioned in text D. So what medications? Okay, yes, for the spinal cord contusion, that is one of the keyword. Currently, there is no treatment available to repair damaged or bruised spinal cord. So healthcare providers try to manage the injury and reduce swelling by using medications like. So that is another keyword from the question. So what medication? That's corticosteroids. Okay, so answer is corticosteroids from text D. Okay. Hi, Anu. Yes, 6 to 48 hours. Okay, dear. Then 11th one, the initial test employed by the healthcare providers to assess a blunt cardiac injury. So my keywords: initial, then okay, employed, healthcare providers. Yes. So these are my keywords: initial test employed by the healthcare providers to assess blunt cardiac injury. Okay, so the word blunt cardiac injury, actually it is mentioned in text B, I guess. Okay, so what about the correct answer for that particular question? Yes, ECG or EKG from text B. Okay, so the last point, records of the electrical signals from the heart and is often the first test. Yes, initial test, one of the keywords. Healthcare providers, yes, another keyword, use if they suspect a blunt cardiac injury. So answer is ECG or EKG. Okay, yes, yes, very good. Okay, Donna, Sobi and Shiny, yes, correct answer. Okay, Prija, ECG or EKG. Okay, then the next one, what might get ruptured, which means break, okay, wound or break, following a blow leading to the leakage of blood under the skin. Okay, so my keywords: ruptured and leakage and skin. Okay, so these are the keywords. 12th one. Any idea? What might get ruptured following a blow leading to the leakage of blood under the skin? So definitely your answer will be from text A, right? Okay. And what is the correct answer? Any idea, Fiba? Prija, Shiny, Sobi, Donna, Anu, Jisha, yes. Okay, so that's from here. A contusion or bruise occurs when you receive a direct blow or an impact on your body. When this occurs, the small blood vessels tear, which causes blood to leak under your skin. So these are the keywords, like, right? Leak, skin. So answer is small blood vessels. Okay, small blood vessels from text A. Okay, then 13th one, total number of patients who got injured again during the recovery phase. So my keywords: total number, then recovery phase. Okay, that's all about text C. Okay, So what about the number of patients during recovery phase? Okay, see, re-injury during rehabilitation. Okay, so that means it's number of patients which is 5. Okay. Yes, Donna, answer is 5 from text to C. Very good. So that's from C, answer is 5, just 5. Okay. And the last one, 14th one, the best tool to detect blood clots or internal bleeding. So best tool, we need the name of the tool maybe. Okay, tool, detects blood clots, internal bleeding. So 14th one, okay, Shiny, it is 5. Yes, Anu, answer is 5. Yes, Sobi, 5. Yes, Donna. Okay, and 14th one, any idea? 14th one, CT scan from text B, right? Okay, Donna. So answer is correct. It is either you can write computerized tomography scans or you can write CT scans. Okay, both are correct. A very direct answer from text B. Okay, so yeah, so that's here. Third point, computerized tomography or CT scans, another imaging tests. Okay, that is often used to check for, evaluate the severity of brain contusions. Very good. Okay, so yes, Prija, CT scan. Okay, Varsha, CT, not CT, CT scans. Okay, yes, Donna, CT scan. Okay, yes, Feba, Jisha. Okay, very good. Okay, so now we are moving to the last set of questions, which is fill in the blanks. Okay, yes, first one. Dash is helpful in determining the severity of a brain injury or contusion by assessing one's ability to follow directions. Okay, any idea? Dash is helpful. So what is helpful here? What is helpful? Determining severity and assessing. Okay, so what is the correct answer for that particular question, 15th one? Okay, dash is helpful in determining the severity, so which means the clinical assessment. Okay, so it should be GCS or Glasgow Coma Scale. Okay, so that should be the correct answer. But see, and abbreviation is not mentioned anywhere in the paragraph, right? Okay, so you should write the full form. Okay, don't write abbreviation because it is not mentioned anywhere in the para. So that you have to write the full form. Okay, Glasgow Coma Scale. That should be the answer. Okay, Jobin, don't write GCS because abbreviation is not here. So answer should be this. Okay, so answer is Glasgow Coma Scale. Okay, and 16th one. It is essential to eat foods that are rich in calcium, protein or vitamin D to promote dash. So calcium, protein, vitamin D. So what is next to promote what? Okay, so that's all about the management, I guess. And a lot of, yeah. So it's from here, bone contusion, eating foods rich in calcium, protein or vitamin D to promote bone health. Very good, Donna. Yes, Reenu. Very good. Okay, Ashna, bone health. Yes, excellent. Bone health will be the answer. Okay. Yes, so B, answer is bone health. Yes, Jisha, Jobin. Yeah. And 17th one, bone contusion is characterized by stiffness, aches, swelling or dash. Again, yes. So what is the next one? Stiffness, aches and swelling or a dash or a what? Okay, so yeah. It's here, bone contusion again, stiffness, aches, swelling or dash, hard lump. Okay, or you can write a hard lump. Okay, that is the answer, a hard lump. Because in the question I think there is no, sorry, A is already there in the question. Okay, article is already there, so you don't have to write it again. So answer should be, yes. Okay, so answer should be hard lump from text A. Okay, so 18th one, a distinguished kind of X-ray that looks upon spinal cord injuries are called dash. Okay, so distinguished X-ray spinal cord injuries. Okay, yeah. Okay, Swati, hi. Yes, heart lump. Okay, Reenu, heart lump. Yes, Obi. Yes, dear. Okay, I'm so sorry. A is already there. Okay, yeah. So, very careful. Okay, Donna. So what about 18th? 18th one, any idea? That is myelogram from text B. Okay, Ashna, Donna, yes, very good. Yes, Sobi, yes, Bindu, it's myelogram from text B. Okay. Yes. Yeah, myelogram, a special type of X-ray that checks for spinal cord injuries. Okay, that's called a myelogram. All right, and second last one. Among the 3,875 cases in the dash register, okay, so what register? Then again, 3,127 are the cases other than hamstring injury. So yeah, of course, without any doubt, I can go with text C. And what about the answer? All injuries registered. Okay, answer should be COR, that abbreviation. Okay. Yes, Feba, Shiny, Anu, Jisha, it's myelogram. Yes, Renu. Yes, Bindu. Okay. And 19th one, it is COR. And the last one, okay, symptoms of dash include bleeding. So I should be actually small letter. Okay. Bleeding and swelling inside and around the brain, headaches, loss of consciousness, seizures, slurred speech, and trouble walking. Okay, symptoms. Of course, symptoms mentioned in text A. So what about that? Okay, so brain contusion should be the answer because it is the symptoms which includes bleeding, swelling, then headache, loss of consciousness, seizures, slurred speech, trouble walking. So answer should be brain contusion. Okay, very good. Yes. Okay, so B, yes, Donna, Ashna, Reenu, brain contusion. Yes, very good. Okay, so I hope it is clear today's session. Okay, I'm going to wind up it. Okay, so that's for today. So thank you all. Take care.